Let us continue. A further unique aspect of this important substance is that the vitamin C in amla does not dissipate either under high heat or reasonable aging. This is because it is bound up with certain tannins. Besides being detoxifying, especially to the liver, amla is also highly nutritious, with each of the three substances in Triphala assigned to balance each of the three humors. Triphala itself is considered balancing to all three humors and safe to take year-round for eliminating all excesses, while imparting strength to the entire gastrointestinal tract. It is the safest and best mild purgative to take on a regular basis and will cause no laxative dependency. Western herbs. Western herbs include detoxifying and alternative herbs such as burdock root, artium lapa, dandelion root, taraxacum op, sarsaparilla smilax op, caparal, Larea divaricata, purgative or laxative herbs such as rhubarb root, Rheum palmatum, buckthorn bark, Rhamnus cathartica, cascara bark, cascara sagrada, blood-moving or iminagogi herbs such as wild ginger, Asarum canadense, blue cocos, Caulopilium, Talictroids, motherwort, Leonorus cardiaca. Let us go to continuation. And chi-regulating carminative herb such as green citrus peel, Citrus reticulata, and ginger root, Zingiberis op. Overall chi stagnation. This is called the mother of all stagnations. It is usually caused by a disharmony of the seven emotions. See chapter 8 for a detailed discussion of this. You can see the tabulation. I will read. Organ, vice, virtue. Babasahin ko po yung organ, then followed on right side, middle and right side. Organ nasa left side. Okay? Organ, next is vice, then virtue. Liver, anger, frustration. Benevolence, forgiveness. Heart, overexcitement, overachieving. Compassion, care for oneself. Lung, grief, sadness. Conscientiousness, correctness, feeling good about oneself. Spleen, obsession, overthinking. Empathy, centeredness. And kidney, fear, paranoid, worry. Courage, wisdom. Okay? Times. In ancient times, part of a physician's job was to help change vices into virtues. This was called culturing the virtue, and healing occurred when the vices were changed to their corresponding virtues. Taoism, the underlying philosophy of traditional Chinese medicine, also focused on changing personalities. The seven emotions, fear, anxiety, pleasure, anger, sympathy, fright, and sadness were all considered the main part of Chinese medicine until the early 1800s. During the Han Dynasty, the five elements were used to transform the emotions, and the famous clinician Sun Tzu Miao use one emotion to overcome another. Formulas for treating stagnation diseases affecting all three jaws. Triple warmer caused by the seven emotions. Citrus and Perilla combination. Fencing Chi Yin for removing all five stagnations. Stagnation relieving pills. Yu Chu Wan. Next, Yin and Yang. Yin and Yang are a summation of the 8 principles. They include Yang excess, Yang deficiency, Yin excess, and Yin deficiency, and are defined and treated as follows. Let's as define. Yang excess. Yang excess, this is the same as excess heat with symptoms of high fever, restlessness, red complexion, loud voice, aggressive actions, strong odors, yellow discharges, rapid pulse, and hypertension. For instance, herbs that detoxify, drain fire and heat, and promote bowel movements are most useful here. This can include the formulas and herbs given earlier under the categories internal heat and external heat. Next, Yang deficiency. Yang deficiency. This manifests symptoms of lethargy, coldness, edema, poor digestion, lower back pain, the type of constipation caused by weak peristaltic motion, and lack of libido. Here there is a lack of heat and activity to perform adequate functions in the body. This is the same as the category of internal cold. Refer to that section of herbs and formula. Next, yin excess. Yin excess. This is the same as internal dampness described under the pernicious influences. These imbalances include symptoms of excessive fluid retention, lethargy, a plump or swollen appearance, and overall signs of dampness. And yet, these people may have adequate energy. Spicy, warm-natured herbs such as ginger, ganjiang, and cinnamon rogui, and diuretics such as falling mushrooms can help promote the elimination of excess water in such cases. Right? Yin deficiency. Yin deficiency. This is the same as the category deficient heat mentioned earlier. These diseases involve emaciation and weakness with wasting heat symptoms, termed false yang. Such individuals are nutritionally depleted to the point that they begin to manifest false heat symptoms, but in the context of deficiency rather than excess. For instance, an individual who is emaciated runs on nervous energy, talks fast but peters out quickly, sleeps poorly, and has little stamina and low resistance is experiencing emptying or yin deficiency. Refer to that category for herbs and formulas to treat this condition. Next, combinations of patterns. Obviously, there can be combinations of more than one imbalance. Some examples of this would be external excess heat, skin eruptions, rashes, boils, eczema, strong body odor, possibly heavy or no sweating, restless sleep, anxiety, mucus is yellowish or even red tinged with blood, Breathing is loud and strong. Pulse is floating, rapid, full, and or tense. Urination is scanty, darker colored, tends to be constipated, or have diarrhea. If they have a fever intends to be high, this is yang within yang. Therapeutic principle: clear external heat, eliminate toxins, dry upper and lower damp heat. The herbal properties should be cool or cold, emphasizing the use of cooling diaphoretics, antispasmodic, diuretics, nervines, expectorants, antipyretics, alternative, febrifuges, purgatives, and astringent formulas. Lonicera and Forsythia combination. Ying Chow San. Western herbalism gives detoxifying and eliminative diaphoretic heat-clearing herbs. Next, external excess cold. Cold is steep, slow-moving, lowered immunity, aversion to cold, wind and damp, lack of sweating, lower fevers, with a tendency towards chills. Complexion is pale, puffy and swollen, tends to drowsiness and sleepiness. Mucus is clear or cloudy, white. Breathing is strong and labored. Tendency towards frequent urination, which is light-colored. Stool is normal to loose. The pulse is floating and full, and the tongue is pale, scalloped, moist with a white coat.